Okay, so let's talk about some of, this is one of the top questions I get, Dr. Osborne, what kind of supplements work well to support these processes? And so if we're talking about chronic pain, we really want to talk about, chronic pain that might be inflammatory in nature, that's affecting predominantly the muscle. Okay, we have nerve pain, which is pretty self-explanatory. It predominantly affects the nerve. That general pain is typically the muscle. Okay, and then we have the joints and the pain within the joints itself. So the cushion or the cartilage within the joints. So what I've done is I've classified for you some of the top hacks, some of the best things that you can do that actually work. And let's talk about this, because where a lot of people make mistakes, and one is the quality of the supplement they buy is junk. So they go over to your basic drugstore and they buy the junkiest, cheapest thing they can find that's full of ton of fillers. And many of those fillers have grain in them and corn, and they're genetically modified, and they have pesticide residues. That stuff isn't going to get you any better. It's not going to get you ahead. And this is why in medicine today, a lot of doctors kind of poo-poo the idea of nutrition. One is they don't understand it. They don't have any background or training in it, so they really can't speak intelligently about it. And a lot of times what people don't understand, they fear, and so then they tend to want to dismiss it. But in order for these things to be effective, you've got to do it meaningfully. You can't just throw a little at it and see if that helps. So when we talk about general pain, there's some rough guidelines here, and that when I talk about rough guidelines, I'm talking about for adults. I'm not talking about for children. I'm talking about predominantly for adults. But vitamin C is one of the most effective things. It's one of the most effective natural anti-inflammatories, and it's very, very effective for people with chronic elevations in pain, especially, we're going to talk about some lab hacks, but if you have elevation in C-reactive protein, CRP, and that's a test you can have your doctor run, then vitamin C oftentimes works really, really well at helping improve this inflammatory marker. See it time and again. So with vitamin C, though, to be effective, you can't just take 500 milligrams of vitamin C and that's going to be effective. For most adults, you're talking anywhere from 3 to 5 grams, okay, per day. And that needs to be done and divided. It can't be, if you take it all at once, it'll give you diarrhea. So you really want to split that out over the course of the day, several hours apart. So take a gram every several hours to achieve these higher levels. So that 1 gram, by the way, is 1,000 milligrams. So again, that's with vitamin C. Then we have vitamin D. This one works extremely well. I see a lot of people develop chronic muscle pain. This is especially true of people that have polymyalgia, chronic myalgia, fibromyalgia. Their vitamin D levels are on the floor, and that's another simple lab hack is you can ask your doctor to run your 25-OHD, very simple test, and what you're shooting for is your range should be between 70 and 100. The reference range in most labs is 20 to 100, but you really, for chronic pain, you want to get it to 70 to 100. And that might take anywhere between 6,000 and 10,000 units a day with vitamin D. So again, a lot of doctors will say, oh yeah, take a little D, and they'll 1,000 units. 1,000 international units is like trying to spit on a forest fire. When you've got chronic pain, when you've got chronic inflammation, 1,000 units isn't going to come anywhere near it if your vitamin D levels are deficient. As a matter of fact, if your D levels are under 50 and you're supplementing, even with some of these supplements that contain 4,000 or 5,000 units of D, you're probably not going to move your levels at all. Like you'll be on that 4,000 units and your D won't change. You go back to your doctor, if it was 40, it stays 40, even being on 4,000 units. A lot of doctors are gun shy around vitamin D because they think it's fat soluble, therefore it's more toxic. And the reality is it's not. Vitamin D is not toxic. It has a lower toxicity, you have a lower toxicity risk of taking vitamin D than you do of drowning. Right? So of drowning by drinking a glass of water, not drowning by jumping in the ocean, but vitamin D is very, very low toxicity level, contrary to popular belief. So this is a must. These two are must, vitamin C, vitamin D. Another one is quercetin. The quercetin, when you combine it with vitamin C. So vitamin C plus quercetin, there's a synergism that they work better together than when you're taking them singularly or apart. They have a synergism, and they work. They're the location in your cell where these quercetin and vitamin C work is the same location that steroids work on. So this is it's a similar, whereas steroids more of a suppression, these are more of a support. So you don't get the side effects of steroids when you combine vitamin C and quercetin. So these two together, very, very effective at supporting that normal, healthy inflammatory response. And quercetin, from a dose perspective, anywhere from, I use clinically anywhere from 4 to 6 grams. Now, I wouldn't recommend doing that long term if you're not being monitored, but you can do it for several weeks, and if it's helpful, you'll have an idea that it works for you. Then we have omega-3. Omega-3 is very, very important. This is one of the earliest series of research studies that when I was in graduate school, when I was actually working in the VA hospital in the rheumatology department, and we were treating patients that had rheumatological arthritis, and I couldn't get the doctors there to talk about nutrition or to want to do anything with nutrition. So we tried, because omega-3 is a prescription too, you can write it as a prescription. We tried to get those doctors in the VA hospital to use omega-3 because there were some really compelling studies that were showing that 4 to 8 grams of omega-3 was more effective at pain relief and inflammation control than ibuprofen, right, which is the classic anti-inflammatory. But this is very effective. And so, but again, it's the matter of how much you're getting. So with omega-3, it's 3 to 5 grams if we're really trying to get pain, inflammation support. So a lot of people will take like a 500 milligram capsule and they think they're taking enough. It's like spitting on a forest fire. You're not going to do much. You've really got to get high doses of EPA and DHA, omega-3, on a daily basis. And so this again is a day. Where you have to be careful with omega-3 is if you're on blood thinners. Your doctor's got you on blood thinners. You need to, before you start taking high doses of omega-3, talk to your doctor about that interaction, because omega-3 can naturally thin the blood. So if you're on blood thinners already, you don't want your blood to be so thin that you bump something and start bleeding, right? Additionally, if you're about to have surgery, so like if you're getting ready to go in to have a surgery, omega-3 is one of those that you want to discontinue a good week before your surgery, because when you're going into surgery, you don't want your blood so thin that it becomes a complicating factor of the surgery. So just keep that in mind. We also have turmeric, and predominantly turmeric, let's make some room here. Turmeric, there's one of the main active ingredients in turmeric is called curcuminoids. Curcuminoids are the most well-researched component of turmeric. And the anti-inflammatory impact or effect of turmeric, as far as we know, the curcuminoid family is very beneficial. Now, you can use whole turmeric as well, just like you can eat vitamin C, you can eat quercetin. There's plenty of food source for these nutrients. But if we're going to try to dose them in higher doses to support inflammation and pain, again, food's great, and always you should be eating the food. But what I'm trying to do is give you more kind of some actions that you can take if you want to use some supplements, right? So turmeric, here is 2 to 4 grams a day. Again, you got to get it up there, 2 to 4 grams a day. And a lot of you are taking 500 milligrams. I mean, I sometimes put people on 7 grams of this stuff a day, just depending on how bad the situation is. But 2 to 4 is a really safe place to be. Again, this is a whole food supplement, so there's really no huge risk for side effects or major issues. Then we have magnesium. Magnesium is super effective because what magnesium does is it's a natural muscle relaxer. So if you've got muscle aches and pains, muscle tension, muscle spasm, magnesium can help to relax those. It's nature's muscle relaxer. And so anywhere with magnesium, anywhere between 600 and 1,000 milligrams per day in divided doses. You've got to be careful sometimes with magnesium. Some of you may take it even at doses at 100, 200 milligrams. You take it, you get super tired, and it just wipes you out. So test it first. Don't just run in and say, oh, Dr. Osborne said 600 to 1,000. Test out 100. If it makes you super brain foggy and super tired, magnesium might not be the best fit for you, so just keep that in mind. And then we have this combination, this is especially true, they're oftentimes found together, glucosamine, chondroitin, and MSM, but MSM has anti-inflammatory properties. And so from a muscle pain, inflammatory pain, MSM can be very effective, 500 to 1,000 milligrams. But usually you'll find it together with these other two agents, glucosamine and chondroitin. And what these guys do, these are called GAGs, they actually, what's interesting, glucosamine has been shown to block a protein from wheat called WGA, wheat germ agglutinin, which is a protein found in wheat that can also cause inflammation independent of gluten. And this is one of the #1 natural relief supplements sold on the market today. And one of the reasons it works so well is it blocks that wheat germ agglutinin. So glucosamine, chondroitin, and MSM can be very, very effective. Generally, the trifecta there is about 1,500 milligrams. So 500 milligrams 3 times a day is a good way to position that. So again, these are all just kind of general muscle inflammation, so things you can do to support that. And then we have the nerve. And so there's a number of different things. You'll notice it's a little bit different. And again, that doesn't mean if I'm not talking about something, maybe you took something and it helped you, and that's different than what you're seeing on my list. What I'm trying to give you tonight is not the full review and breakdown of every medicinal plant or nutrient or compound that was ever studied to be effective. What I'm trying to do is share with you the wisdom from my practical clinical experience and dealing with thousands and thousands of people over the last 21 years. So we've got hemp. Now, specifically not hemp, but CBD, cannabidiol, which is a component of hemp. And so CBD can be very effective if your pain is stemming from a neurological issue. Now, I will caution you. Here's why I want to caution you. A lot of people, they jump to this stuff first. They just say, the heck with it. They ignore everything I talked about tonight. They ignore this entire thing. And they say, you know what? I don't care. I'm not going to change my diet. I'm going to do what I want to do. I will say this. If you ignore the diet aspect, you'll never find an answer because your body's smarter than you. You might not realize that, but your body will adapt to your ignorant choices by finding a new way to set off an inflammatory fire to tell you to stop it, right? And what most people do is they'll jump from supplement to medicine to procedure, etc. They'll just jump around trying to figure out how to put the pain down, but they'll never backtrack to that diet and to those fundamental choices. It's important that your diet's dialed in because these things will be minimized. They won't work very well if your diet's not dialed in. So remember, what we're not trying to do is appease pain without understanding why the pain's there. Now, I know one of the questions in the feed tonight was, hey, I just took a tumble and I really hurt myself. I face planted or I injured my joint. Like there's physical trauma that caused that pain. That's different. Okay, if you've got an acute physical reason why your pain started, any of these things may be effective or helpful for you to recover, and it's perfectly fine to do. But if you've got chronic inflammatory pain and you don't know why, start with food, start with diet. Don't start here, okay? A lot of you start backwards. Don't do that. Anyway, I've said enough about that. CBD can be very effective for neurological types of syndromes. So CBD, where you got to really get 25 to 50. And I would start there. Some people go up from that, even as high as 100, 200, but 25 to 50 of a very good quality. The key on this one is quality, because not all of it, there's so much of it now, it's so popular, and there's so many people manufacturing it. A lot of the quality is contaminated with metals, contaminated with other compounds or adulterants, and so for it to really work, you want to make sure it's very, very pure. Magnesium, as I mentioned over here about magnesium, 600 to 1,000 milligrams a day, same thing here. Magnesium can be very effective. Remember that for your nerves to be able to properly communicate, magnesium is critical as an electrolyte. And then we have B vitamins, particularly in this case, B12 folate and B6. And well, we'll talk about why in just a minute, but also vitamin B1, if we're talking about neurological pain. Vitamin B1 deficiency can cause a condition known as beriberi, which is damage to your nerves. But so B12, folate, and B6 can also all cause, deficiencies rather, can all cause nerve damage. And we'll talk about more on this. Just stay with me because we're going to talk about this in lab hacks in just a minute. And then alpha lipoic acid. This is a very effective one. If you struggle with neuropathy and you're trying to help your body, alpha lipoic acid can be very, very helpful, but you got to get it enough. You got to get, a good 1,000 milligrams a day is a good place, really therapeutically to start. And oftentimes I even go much higher in certain individuals even than that. Again, neurologically, theanine, which is an amino acid, works really well. As a targeted amino acid therapy, can work really, really well at kind of modulating how your body neurologically perceives pain. Same thing with GABA. GABA stands for gamma aminobutyric acid. And so again, these are 500 to 1,000. With GABA, you can go up to 1,500 in this milligrams. And then you've got 5-HTP. So GABA works because GABA is like the braking system of the nervous system itself. So if your nerves are hyperpolarizing, creating pain response signals repetitively, GABA can kind of taper that and calm that. So can L-theanine, and when you use them together, they can actually have a synergistic effect. And then 5-HTP, which is a 5-hydroxytryptophan, can be very effective anywhere from 100 to 500 milligrams. Where you have to be careful with this one is if you're taking any kind of antidepressant, SSRIs, if you're taking like a selective serotonin reuptake inhibitor like Paxil or Prozac, you got to be real careful. You don't want to combine those without being under direct medical supervision. Very important that you understand that, because it can enhance the SSRI if you're taking one, and it can actually create a very big problem for you called serotonin sickness. So be cautious of that. Don't just do this blindly if you're taking those medicines. All right, if we're coming over here to joint relief, and you've got, this is kind of more like, hey, I have wear and tear. What can I do to kind of add or support the cartilage and the cushion, right? And so one of the best things is collagen. Collagen is very effective, and a lot of people's diets today are really devoid of the protein sources that deliver quality collagen for the production of cartilage. So collagen, very, very important. You can use this as a supplement. Most of you don't eat the collagen off of the chicken bones. If you're eating a chicken drumstick, most people don't rip that really solid kind of chewy part and just chew on that for a few hours. Now what you can do is, if you have like a pressure cooker, you can put those whole bones into a pressure cooker and you can cook that down into like a broth, and you can get some really great collagenous tissue in your food. But supplementally, you can also get collagen. So with collagen as a supplement, anywhere between 5 and 20 grams a day, just depending. That's where I'll take some people that come to see me. So 5 to 20 grams a day, just depending on how much support we need to give them. Magnesium's the same. You notice magnesium's all the way. Magnesium's like human duct tape, but works really, really well at the same doses. And then electrolytes. And one of the reasons why, what happens, most people don't get adequate fluid. And with today's world, the world we live in today, a lot of times, a lot of people are buying bottled water, and a lot of that water, it's RO filtered. Now, RO water is probably one of the best waters you can drink as far as not having chemicals. But when you run water through a reverse osmosis filter, you pull out electrolytes. And so over time, if you're drinking that every day and you're not replacing your electrolytes, you can become dehydrated. Now, when you're dehydrated, your muscles tend to cramp and spasm. They become tighter. So imagine your muscles are chronically 5%, 10% tighter. That means they're compressing those joints. So like if this is your leg, right, you see your knee joint here, the quadricep muscle ties in across the knee, and then you have the calf muscles and you have the hamstring muscles here. Imagine those muscles are all tighter. Well, what are they going to do? They're going to compress that knee joint. They're going to pull it in and compress it. So if there should, normally in a knee, there's a nice little joint space in between the top of the leg and the lower leg, but when those muscles are too tight, that joint space is diminished as a result of compression, because you've got atrophy and shrinking and tightness in the muscles, and a lot of that can be dehydration or lack of electrolytes because of RO water without properly adding electrolytes back in. So key there is use electrolytes, especially if you're filtering your water with an RO source. And then, as I mentioned earlier, glucosamine and chondroitin, these actually form the substrates along with collagen that you need to produce healthy cartilage. So that's why they're under the joint section. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.